Knee pain. It can happen to anyone and make even everyday activities a challenge. But with the right support, you don't have to let it hold you back. In this video, you will learn how you can self-tape your knee to reduce that pain and keep you moving. This method is useful for managing instability of the kneecap or knee pain associated with running, squatting, or climbing stairs, otherwise known as patellofemoral pain. It is important to emphasize that this video series is not intended to replace advice from a healthcare professional, but to be used in conjunction with it. Before getting started, you'll need to get your hands on some McConnell Therapeutics Undertape and McConnell Therapeutics Rigid Tape. Start by sitting on the edge of a chair with the sore leg out straight and the muscles relaxed so that the kneecap can be moved freely. If you are not on the edge of the chair or the muscles are not relaxed, then the kneecap will already be engaged poorly in the groove of the thigh bone and won't move. First, you are going to need McConnell Therapeutics Undertape, which has been expertly designed with increased flex to protect the skin while maximizing joint movement. This allows the rigid tape to work harder to better support your joint. Place the first piece of tape by feeling the top and bottom of your kneecap to find the halfway point. Starting on the top half of the kneecap, coming over the top with minimal tension and anchoring at the back of the knee as you can see here. The next piece of tape that you will need goes from the prominent bump on the top of the shin bone wide out to the bottom of the thigh bone on the inside of the leg, joining the first piece of tape. The final piece goes again from the bump on the shin to the outside of the knee, but stays wide of the first piece of tape, forming a triangle that surrounds your knee. The tape should form a wide V that joins at the bottom of the kneecap that allows the knee to bend. Test that the V is wide enough by bending your knee and ensuring that you still have freedom of movement. Once the undertape is in place, it is time to use the rigid tape to give your knee the support it needs. Utilizing over 40 years of experience, McConnell Therapeutics Rigid Tape is designed with the ideal balance of adhesiveness and strength to give you the utmost confidence in your strain and sprain support. Pull along the length of the tape and then rip like so. The serrated edge of the tape is designed to allow you to tear it easily by hand. To place the first piece of tape, find the middle of the kneecap with the leg out straight and relaxed. This piece goes from the middle of the kneecap to the inside of the knee, gently lifting the skin with one hand and firmly pulling the tape with the other, placing the tape on the back of the knee, easing the tension off gradually as you go. This tape tilts the outside edge of the kneecap up and lifts the bottom of the kneecap out of the fat pad, which is the most common source of knee pain. The second piece of tape starts just past the edge of the kneecap and comes across to the inside and over the top of the existing piece. This effectively shifts the kneecap into the groove of the thigh bone. The third piece of tape starts on the prominent bump on the shin bone at the intersection of the undertape that you have already applied. Lift the soft tissue with one hand towards the kneecap and pull the tape very firmly towards the inside of the thigh bone with the other. This should create a fleshy muffin top over the top of the tape. To place the final piece of tape, anchor the tape again on the prominent bump on the shin bone and pull the tape to the outside of the knee joint while pulling the soft tissue towards the kneecap with your opposite hand, completing your fleshy muffin top. You can get back to basic tasks right away, but for intense exercise sessions or activities, give the tape 5 to 10 minutes to properly set. For more information on what might be causing your knee pain, don't forget to check our McConnell Therapeutics Causes of Pain series. And remember, this doesn't replace seeking professional advice.